Welcome everybody to another amazing episode of Wellness Warriors. Today I have another fellow colleague and someone that I can really call a friend, Dr. Tony Youn. Thanks, Tony, for taking the time out of your busy schedule.
Well, thank you so much for having me. It's my pleasure.
So Dr. Tony is quite the accomplished doctor. We met through a business mastermind, and I liked him right away, just as a person, as a human being. He has a very big heart, but he also has a list of all kinds of accomplishments. Medical doctor, he's a nationally recognized board-certified plastic surgeon. He's written several books, everything from The F.A.C.S to In Stitches, a memoir. He has a PBS special called The F.A.C.S that's been very successful. He's also has a podcast that's called The Holistic Plastic Surgery Show. And so with that in mind, I'm going to start off by asking the question. So we don't really put holistic and surgery together. So how did you combine the two, Dr. Tony?
So I think that's a great question. So at one point in my career, several years ago, I thought I had reached the pinnacle of success. You all right?
Sorry, just
and I had patients flying in from all over the country to see me. I was performing surgery every 2 days, and we had a big waiting list. And I had this patient who came to see me who said she was in her early 60s, and she said, "Look, I don't feel like I'm visible to people anymore." And she said, basically, I feel like people don't see me. And she said, all my friends have had plastic surgery, and so I'm thinking about having a facelift myself. And this is a story I hear from so many women and even some men as they get older. They feel like less and less people even see them. They don't feel as much a part of society as maybe they used to be. And so some of them, they look at plastic surgery as an avenue for them to regain, in some ways, their lost youth, and what they hope is that visibility, that attention that they used to get. So this patient, when I looked at her, she seemed like a reasonable candidate for surgery. And several weeks later, I brought her back. We did a facelift, and the surgery went very, very smoothly, and it basically lifts the lower face and the neck and the jowls. And as I was driving back to my office after the surgery, I got a page from the hospital, from the nurse, and the page was 911, which you can probably guess that's bad news. So the patient started bleeding, and as a plastic surgeon, I know that when somebody bleeds, it goes from 0 to 60 in like 2 minutes. And the worry that I have is that the neck can literally fill up with blood, and the person can literally suffocate from all the pressure. So I zip my car around, I floor the accelerator, and I go as fast as I can back to the hospital. I run up the steps to her room, and when I enter her room, I don't see my patient sitting there, but I see somebody who resembles Jabba the Hutt. Her neck is so filled up with blood. I take a pair of scissors, I throw some gloves on, not even any antiseptic, nothing like that. I cut the sutures out, and I take handfuls of blood out of her neck to decompress her neck.
Wow.
Bring her to the operating room and find a little bleeding blood vessel where the clot just popped off. And what it really taught me here I thought I was at the pinnacle of my career. And luckily the patient did really well. But what it really ended up being is this kind of slap in the face of, okay, are you sure you're doing the right thing for everybody? And it got me to really think, okay, am I really doing everything I can to get my patients what they need and what they want? Or am I going to surgery too quickly? And that's where I started thinking about this whole idea of like, is there a better way to do this? Is there a better way to help people help themselves? And so the idea of holistic plastic surgery is this better way. It's combining so many things that we can do to look and feel our best using actual surgery as a last resort. So the right foods, the right clean skincare, a lot of things that you recommend in your book, Veronique, and that you recommend to your followers, because a lot of those things can really make massive impacts on your appearance. And on top of that, there are a plethora of non-invasive options out there that we can use to help us look our best too.
And you've got an amazing skin line too that helps to support that.
Yeah. Yeah, there's so many toxins and there's so many chemicals out there in our skincare. And I don't think people realize, it's like so many of us, we choose to eat organic. We're very choosy in the types of food we put in our mouth, yet we just buy a cream at the drugstore, the department store, and slather it all over our face, not thinking that, hey, wait a minute, what we put on our skin a lot of that does get absorbed into our bloodstream as well.
Absolutely. So as a plastic surgeon, I know that you've come across a situation with women's implants. Do you still do implants, or have you stopped doing those?
I do. And, this is a big controversy right now. And, it's very interesting because right now you've got a group of plastic surgeons who still will jump up and down, get a red face and say breast implant illness is not real. It's not a diagnosis. It's a psychiatric condition. And then you'll have patients and their supporters who will say that implants are toxic and nobody should get them done. And if you put them in your body, you're going to get ill. So, where I trained, Veronique, was in traditional, plastic surgery residency, where I was trained and taught that the studies show that there's no evidence of breast implant illness. This was dealt with back in in the 1990s with the Dow chemical, and that breast implants are safe. And then what's been going on is the power of the internet, as you know, and tens of thousands of women who are getting together, sharing their stories, which are remarkably similar to each other. Mm-hmm. And that really did get me to reassess what's going on here. And so I did look at our plastic surgery literature, and other than one article, which was a massive article that was a combination of multiple studies, nothing in the plastic surgery literature supported the existence of breast implant illness. And that's why plastic surgeons believe that. However, outside of the plastic surgery literature, that's a different thing. And so, I don't fault some plastic surgeons, because I was in that too. But when I actually did look at the literature from rheumatology and started finding that there are studies, these aren't big studies, but there are studies that do show a higher incidence of certain types of autoimmune disease, scleroderma, Sjogren's syndrome, fibromyalgia with women with breast implants. It really got me into thinking and looking really back into it. And yeah, I do believe breast implant illness is real. And I think that my hope is that within the next couple of years, we'll have more studies that plastic surgeons will look at and say, yeah, this is something that we really need to deal with.
Right. And revisit it in the sense of maybe safer products or different procedures or whatever. But yeah, so, a lot of women that we've coached, when they get a mastectomy, they're, on the treadmill to, get implants right away and reconstruction. And they go through such a difficult time having just been through a mastectomy, and then they jump into reconstruction right away.
Yeah.
I always encourage them, take your time, give your body a chance to heal, recover from the cancer before you jump into something like this that could affect your immune system.
The difficult part of that, and I can see the other side of it, is that there are, to my knowledge, and I don't do breast reconstruction anymore, but there are, to my knowledge, studies that do show that women who have immediate reconstruction, self-image and self-esteem may be better for them because they don't have to go through that period of loss and that period, because being a male, I don't know what it's like to go through that, but my understanding is that there is a period of loss and of grieving when you lose that part of your body. And so there is definitely, my understanding, can be a benefit to the immediate reconstruction. But just like you said, I think that we really do need to study the implants more. We have to find out who's susceptible to these types of issues, because I don't think it's everybody, because there's so many women with breast implants. Not all of them have these types of symptoms, but we've got to figure out who's at risk. And for those women, we really need to educate them and let them know. Yeah. There was a couple of small studies that I did find that did show that women who have a history of severe allergies, as well as previous history of autoimmune disease, which wouldn't be surprising, may have a higher risk of breast implant illness type symptoms after having breast implants. But these were small studies, and that was all that I could find in the literature.
Okay. So another question about skincare. We'll kind of go back to skincare. Yeah. So what are some simple things that women can do, well, men too, to really, make their skin look better, some routines that they can implement throughout the day that could help?
Yeah, so there's some real simple things that I definitely encourage people to do. So every morning, cleansing your skin, super important. And then after that, ideally applying an antioxidant to your skin. So antioxidants basically fight off free radicals. And if you hear the term oxidation, that's what we're talking about. And so vitamin C is the most common one. Most skincare companies have their own line of vitamin C products. There are studies that do show when you combine vitamin C with vitamin E, you can get a synergistic effect of combining the two to help protect against free radicals. So that's what you want to do in the morning. I do recommend typically a sunscreen after that, avoiding oxybenzone and octinoxate. In the evening, super important to wash your face, cleanse your skin, get rid of the day's worth of dirt and grime and oil, and all of that, and the makeup that has built up throughout the day. And then I usually recommend an anti-aging cream to wear or to apply to your skin. Retinol is what I recommend as a starting point. For those people, however, who have more sensitive skin, then there are growth factor and peptide-based creams, I think, that work real nicely to reverse aging while you sleep. And then if you try to exfoliate your skin a couple of times a week, if you've got, pretty much quote unquote normal skin, once a week, if you've got skin that's a little more sensitive, that can also help with the cellular turnover to keep your skin looking and feeling smoother and more youthful and healthier.
That's great. Great. Now, we mentioned several books, and this is your most recent one, Playing God, and interesting title. So just explain to me why you chose that title for this next book.
So this came from a story that is part of the book, but I had a patient who came to see me who was an older woman. She was quite overweight, and she was walking into my office with a cane. And she came up to me and she said, "Dr. Youn, you're my last hope." She said, "I've seen 15 other plastic surgeons, and every single one has turned me down. Will you please help me?" And so I looked at her and I said, well, what's going on? And she said, I had lost some weight and I had a tummy tuck surgery by a different doctor and everything fell apart. I developed this flesh-eating bacteria. My entire tummy turned black and parts of it died off. I had horrible infections. I ended up having skin grafts. I was in the hospital for 2 months. And she said, now I feel like my life is over. She said, I'm in severe pain all the time. My husband won't even look at me. And she said, the worst part about this is I've got a granddaughter that I can't play with anymore. And she said, I've seen 15 other doctors, and because I've got these other medical issues, nobody will take a chance on me. So I took a look at her chart, Veronique, and it was like inches thick of all the different ailments and surgeries and things. I mean, she was just a medical nightmare. She was on blood thinners. She had had multiple heart attacks. She had stents placed. She was diabetic. You name it, she had it. And it was those types of patients that you look at and go, geez, she could die on the operating room table. She is a complication waiting to happen. And so I told her, I said, look, why do you want to do this? And she said, my life is basically over. I said, if I operate on you, you could die. Like, this could be it. And she said, I'm basically dead already. So normally you would think that the thing to do is say no, because I don't want somebody to die under my hands. But I had the sense that wasn't the thing I should do, that the right thing to do would be to help this woman. And I can't tell you exactly why, I think there's, somebody up above maybe watching out for us, but I ended up bringing her to surgery. And the night before her surgery, I prayed to God to help me help this poor woman, because when you look at it from a traditional medical standpoint, this is not a good idea to operate on this woman. So her surgery went without a hitch. It was so smooth to the point where I almost felt that my hands were being guided. And 6 weeks later, she comes into my office, no cane, with a big smile on her face. And she has a carrot cake that she's baked for me. Now, a day or two before that, I found out from an insurance company that they rejected the surgery payment, saying that it was cosmetic, which it obviously wasn't. So she came in, she said, Dr. Youn, I've got a carrot cake for you. And she said, I know my insurance rejected payment. And she said, I don't have any money to pay you. Will you please accept this instead? So I said, well, of course I will. What am I going to do? It's fine. And,
okay.
And then she goes, why did you do it? And I said, well, do what? She said, why did you take a chance on me when nobody else would? And I said, I just felt like it was the right thing to do. And then she said, all these other doctors, they think they're playing God. They act like they are God. And a lot of my other doctors have been like that, but not you. Why not you? And that's where the title of Playing God came from. And it's not, some people have read it and think, oh, who does he think he is? He thinks he's playing God. And it's like, no, it's the opposite. And I probably should have change the title to not playing God. But it's the idea that, I can't do this by myself. I need my patient to work with me. I need the hospital support staff, and I need somebody up above to help me help my patients, because I can't do this alone. And that's where, long story short, that's where the title came from.
No, great story. And when you read the book, you can see that there certainly are doctors that play God, with their patients, even when they're visibly wrong. They're going to stick to their statement or their belief, even to the detriment of the patient. Now, there's one patient that really stays with you. That was in chapter 2. And I guess I really remembered that story because this patient had breast cancer.
Yeah.
And it's really amazing to me that we see that quite frequently. Women are so afraid to, show their doctor or to deal with the breast cancer diagnosis that they ignore it. Mm-hmm. And, in spite of our telling them, you need to check with your doctor, you need to consider traditional medicine, and, things get out of hand. So how did that experience affect you long-term with your career?
I think so this is a story that you mentioned where this was a woman who was basically lived on a farm with her husband. She was a bit older, and her job was taking care of her husband, who was a farmer, and her children and grandkids. Now, her kids were not the best children, so she had to help not only her kids to survive, but her grandkids too. And I think what we see so much, unfortunately, in our society are women who end up not taking care of themselves because they're so busy taking care of everybody else. And that's what happened to this woman. So she was taking care of so many other people, and they relied on her, where, oh, something needs to be done, have mom do it, or have grandma do it, or have my wife do it. And she developed a small lump in her breast, ignored it, and the lump started getting bigger and bigger and eventually became an ulcer. And by the time she came to see us in the hospital, or presented to the emergency room with it, basically, her entire breast had necrosed. And her breast was gone. It was basically this kind of wet, gangrenous flesh. I mean, she was actually putting diapers over it to cover it up. So she'd have her bra on and a diaper there. And when she'd take the bra off, I mean, it smelled like death. I mean, it was dead tissue. And I remember when she looked at us, she said, what do you think is happening? It didn't even dawn on her that she had a metastatic breast cancer that was going to kill her within months. And so this really, I think it struck me because my mother is like that dutiful wife where she does everything for my dad and she does everything for us as a kids growing up. And luckily she never had to go through what this poor lady ended up doing. But I think that that's an issue in our society, is that women in some ways are devalued their health because they're so busy taking care of everybody else. I'm like, oh no, my husband needs to get taken care of because he's the one that does the physical work. When really the most important person in that family was her. And when they lost her, I can't imagine what happened to that family afterwards.
Yeah, and you bring up a good point that we see a lot, and that's why in the 7 essential system, essential number 4 is to heal the emotional wounds. And part of that is to recognize that it's okay to take time for yourself. It's okay to set boundaries and say no. It's okay to nurture yourself and to, because we women wear so many hats, as you mentioned. And so this is, just another example. Now, you mentioned your dad. Now, your dad has had a great impact on your life. You had a great family that you grew up with. And, the whole idea of him being, now what kind of doctor was he? He was
an OBGYN.
OBGYN, okay.
Mm-hmm.
And after years of practice, he ends up being sued. Mm-hmm. And it totally crushed his spirit because he had such love and belief for his patients. So how did that situation impact your professional career?
I think for me, so yeah, just like you said, my dad, he had a practice like 25 years in a small town, in a tiny town in the middle of Michigan. And he used to always, he had a lot of pride in it, that he would boast that, I birthed 5,000 babies, never been sued. And then as he announces he's going to retire, the book, we had one lawsuit is in the book, but he actually had 3 come out of the woodwork all at once. And 2 of them disappeared very quickly because there was absolutely zero merit to it. But the third one was what stuck with him. And it crushed him, because here is this proud Korean American immigrant who basically pulled his whole family out of poverty and lived the American dream. And then all of a sudden that dream started to come crashing down on him. My parents ended up getting divorced, not because they didn't love each other, but because he didn't carry hardly enough malpractice insurance to cover if he lost this case. So they ended up moving their assets into my mom's name, and they got divorced. And it really, I think, more than that, which, eventually, I mean, it'd be one thing if he made a horrible mistake and somebody suffered from it, but it wasn't even the case. It was completely frivolous. It was nothing, not his fault, but it was just the makeup of the time and of the society at the time, of the litigious society. So I think what it taught me, first of all, honestly, it's a fear. It's a fear of being put into that position. For me, I treat 40 patients a day, and I worry about every single one of them. One of the things that's funny, I was interviewed for a TV show recently, and they said, well, what don't you like about or what they said, they asked me, like, do you like being in the operating room? Do you love operating? And I actually tell them, I said, no, I hate operating on people. And yeah, I'm a surgeon. I operate 2.5 days a week, but I hate operating on people because the entire time I am worried that they're going to die the entire time. Or even after surgery, am I so excited when I see the great results a patient has? No, I'm relieved that they did fine, because I know all the bad stuff that can happen. That people can die in the operating room table. They can develop horrible complications and bleeding and infections. And my job is to make sure they don't worry about it, but I do. And so I take care of them. I do everything I possibly can to prevent bad stuff from happening to them. And if I can get them where they want to be and prevent that, then my job is done. But if anything, for me, it's more of a relief, that my patient did well. And I think it's done me well. I've been in practice, knock on wood, 15 years, and the average plastic surgeon gets sued every 2 to 4 years. And I have not had a lawsuit yet. But I think part of it is because I'm deathly afraid of going through what my dad did, of treating my patient, and worrying about them and doing everything I possibly can to try to get them where they want to be. And then them coming after me and trying to destroy me afterwards. Like that scares me. And how will I react to that when that eventually happens?
Or it may never.
Hopefully not, but that's why I joke with my wife.
Intention.
I joke that, when we retire, I'm just going to disappear. Like I tell my employees, one day you're going to show up to the office and there'll be checks on the door for all of you and you'll never see me again.
That's hilarious. Now, one thing I really appreciated about your book, Tony, was, how honest you were. It wasn't like you graduated and then the patients just flowed. I mean, you really had to work hard. You hustled. You brought your business cards everywhere. I mean, there was a trickle of patients initially, but then there was a defining moment where you felt that the switch was turned and everything changed. So what was that? What was that moment?
So I think the defining moment, I had a period of time where my practice initially got real busy. And then I think I lost a bit of myself because I was so busy trying to get the business going and worrying about this and worrying about that. And I had some patients who outcomes were not ideal. And one of them, you may remember in the book, threatened to destroy me. I mean, it was so traumatic. She threatened to hit me with her car, was trying to extort money from me. And it was so difficult. And I think it got to the point where I finally just decided to let everything go and get back to what truly is the art of medicine. In medicine today, we're so focused on so many things other than taking care of our patients, filling out the forms, making sure that we put the right codes in, making sure that we do all the right paperwork, making sure that, as a business owner, making sure that I have enough money, that I sign up enough patients and all this stuff. And really what it comes down to is the art of medicine, of sitting down, talking to somebody, getting to the root of their issue and doing everything you can to try to help them. And when I really got back down to that, everything changed and the patients changed and the outcomes changed. And I think I changed as a result. And it's the difference of being that old-fashioned surgeon, the ones that, you in your field, what you've been dealing with a lot of, I'm sure, your followers, and dealing with maybe surgeons that are not holistic surgeons. They're not modern surgeons. These are old-fashioned doctors that won't listen to them and won't listen to their concerns. And how do you then go to becoming a modern surgeon of today who looks at everything, who does worry about their patients all the time, who looks at their nutrition status, who looks at all the other alternative options, leaving surgery as a last resort, because we know that if you go under the knife, you can die just from going under the knife. And so that's really what all this is. And that's why I really commend you, Veronique, and why I admire what you're doing, because you are helping people and providing this resource for people who otherwise would not get it from the traditional medical system. And dang, do they need it.
Yeah, yeah, they do. They really do. Well, Tony, thank you so much for taking time out of your busy schedule. And I know you have a free gift for us. It's an ebook, 10 Things Every Plastic Surgery Patient Must Know. And we'll post those links. And if, what would be the best place for people to find you if they want to learn more about you?
Yeah, I'm all over the place, from YouTube to Instagram and Facebook and all that, but check out my website. That's probably the best place to start, dryoun.com, dryoun.com. We've got that free gift. It's an ebook, 10 Things Every Plastic Surgery Patient Must Know. Just giving you the information that you need to be an educated patient and consumer. And I love what you're doing, Veronique, as well.
Thank you so much, Tony. So good to see you.
Thank you. You too.